This is a very exciting event for Crossroads Health. It's kind of bittersweet for us that Mike is leaving us, but very exciting that Shayna is going to be taking over. There are quite a few board members here which we'd like to introduce. There's Dan Arian, raise your hand, and Mike Crislip, and I saw Dan Gould, and Hal. Where's Hal?
They had to leave.
Oh, they had to leave? Okay, well, anyway, the board members are just so pleased to present to you our new CEO. Mike gave us a couple years' notice, and we got some names put into the...
Or vice versa.
Right. As the mother of a son who is not only in recovery, but does recovery, I tried to put his name in the list so that we could get him back up here to Cleveland, but a woman named Shayna Jackson came up to us. She has a lot of experience, and once the board interviewed her, she was a unanimous choice for us, and it was just such a relief to know that we were going to have her taking over and guiding New Directions, Crossroads Health, and all the wonderful things that they have been doing every single day for over 40 years. So with that, Shayna, your audience.
Awesome. I'm gonna actually stand for a little bit and then sit, because I'm gonna pivot for a hot minute, because I do want to take a moment and actually acknowledge Mike Mattoni's semi-retirement, because at the end of the day, he has given decades to our community here in Lake County, has grown Crossroads Health into the organization that it is today, a healthy, strong organization that continues to push the envelope of care and making sure that what we do has an impact on the lives of the folks that we serve. So Mike, I am gonna let you know that what we did is we had some of our day treatment folks actually painted a couple of Adirondack chairs for you, so that during your semi-retirement that you and Melissa can sit. You can pick which one you think is yours, but I'm thinking the one screaming the Cleveland colors with the Cavaliers, with the Cleveland Guardians logo might be the one you choose, but I don't know. But really, at the end of the day, I can't say enough, and thank you so much for everything you've done. And honestly, as a mentor, as a friend, as a colleague, because this is a new role for me, and often I am calling upon you to say, what are your thoughts on this? And so with that, I just wanted to take a moment and really acknowledge all of the hard work that you've done, and really your confidence and the board's confidence in me in taking on this position. So I wanted to at least thank you, sir. Now I'm gonna sit, because it's more of a conversation. It feels weird. So, would you like me to tell you a little bit about myself? Do you guys have questions about me, about the organization, where we're going? What are your thoughts?
Questions about the organization and where we're going.
All right.
Some of us don't know you,
Okay.
so I'd like to figure out.
Of course. So I am born and raised here in Lake County. I actually grew up in Willoughby and graduated from Willoughby South High. Went off to school over at Miami University out in Southern Ohio. did my undergrad work there, actually primarily focusing on forensics and mental health, and moved back up into this area about 25 years ago, 30 years ago. And actually worked for a domestic violence shelter for about 20 years. I worked as a therapist there, moved up through the ranks as an assistant director, and then took over as the executive director, where I was at for about 20 years. And that organization continued to flourish, and the opportunity to come over back into Lake County and really give back to the community that I had grown up in came available, and I couldn't really say no, because to have the opportunity to make a difference with the folks that I live, go to work with every single day was just a tremendous opportunity. So I came over as the Chief Clinical Officer for Adult Services. So my background was in both youth, but also adult mental health, and working with severe and persistently mentally ill folks, specifically folks with personality disorders, as well as thought disorders. And as we've grown as an organization, we had our merger between Legacy Beacon Health and Crossroads to create what is now Crossroads Health and New Directions. I got to learn much more about all of the breadth of services, from school-based services that we have to day treatment services that we have, to be able to have the chairs that we've done today. And here we are today, and we continue our organization as New Directions and Crossroads Health, providing all of those services. We've launched primary care services. And one of the things strategically that we really started thinking about as an organization, as we went through our last strategic plan, was what we know about folks with behavioral health issues is, unfortunately, our research shows that they die 25 years sooner than the general public. And they do not pass away from their behavioral health issues. They pass away from chronic diseases, from treatable diseases. Many times our folks, their experiences are varied, and what we knew as an organization, we wanted to begin to provide those primary health care services for the individuals that we serve, so that we can not only work on treating the head, but also the whole body at one time. So in May, we went ahead and launched primary health care services, and actually next week, we are actually undergoing a federal site visit from the Health and Human Services Administration to hopefully become a lookalike, which is basically a community health center that is designed to really provide services to an underserved population, which I cannot begin to say what a privilege it is. What I said at our last all-staff meeting is, I don't want to notify another treatment team that somebody has passed away from a treatable disease. It's heartbreaking, and I am so honored and empowered that we've gone into this direction to begin to provide primary health care services and hopefully make real differences on the lives of our folks as they journey through their recovery, both with behavioral health as well as managing many times chronic conditions.
Thank you.
Yes.
How many doctors do you anticipate will be on board, as well as PAC personnel?
For the primary
Yeah.
care, currently we have one physician's assistant, because we started out just about a year ago. That patients continue to increase in volume, and as we have increasing patients, we'll certainly be looking to, with the Board of Trustees, to say, is it time for us to begin to add additional folks to provide that service? We want to make sure that we always have excellent access for all of the folks that we see, meaning that we don't want folks to have to call our clinic and say, well, we can get you in 5, 6, 7 weeks. We want that to be, we can get you in when you're ready to be seen.
But there's no physicians on board right
Correct. We have, our clinical supervision is provided by an MD through university hospitals.
Gotcha, okay, thank you.
Absolutely. Any other questions about where we're going as an organization? We have about 300 dedicated employees. Many of them are sitting in this room today, who their expertise speaks volumes to the quality of care that we provide to the folks that we see every single day. I see faces out here. I see Tara Katurik sitting out in our audience, who is one of our first touches when folks walk in the door, and you will never meet a more compassionate human being than Tara, where when folks walk in, how they're greeted, how they're treated, how we're able to meet them where they're at. One of the mantras and one of the vision statements that we have as an organization is everything we do, we want to do within a trauma-informed framework. And what that means is that from the time you pick up the phone and you call, that you're hearing compassion on the other end. When you walk in the door, that we're meeting you when you are ready for those services. And that many times we know in general, our folks, when they're walking in the door, many of our folks, their experiences throughout their lifespan, they've experienced traumas. So every person that walks in, we're going to treat them to make sure that we're being attuned to that and listening to what they're saying. And again, making sure we're available at the moment in time that they need that service and that they've decided to reach out. There is a very small period of time in a journey of recovery that somebody may say, it's time. And we want to be that hand on the other side that says, just take my hand. We'll start forward together. And that really does start from the moment you call to when you walk in for services. I can't imagine walking into a strange building and saying, I need help. But I can't imagine, I've seen time and time again, watching Tara walk out and grab that person and say, hey, I'm here for you. Let's get some water. Let's sit down, let's talk. Or a parent who's called New Directions and said, I'm concerned about my child, and I'm not sure where to turn or what to do. And on the other end, funny enough, Tara at New Directions also on the other end says, it's okay. We're gonna do this together, because there is help. All you need to do is be able to pick up the phone and we'll help. And if you can't pick up the phone, walk in. I got a text last night from somebody who said, I need counseling and I don't know where to go or how to do it. They walked in today and received services. We called them this morning, got them scheduled. They walked in for services and started services today. That's the kind of responsiveness and really to be able to hold and walk alongside the people we serve that we want to do. And what we're known for doing. A lot of the folks we serve, sometimes their illnesses make them challenging. And I can tell you that this team works extraordinarily hard to make sure that people stay in services and making sure.
Last
Yeah.
question, I promise.
No, keep them coming, because it's really weird sitting up here in this chair all by myself.
With behavioral health issues, there's a tremendous lack of beds in the Cleveland community. Mainly Lutheran, some elsewhere. Is there any plans in the future to have beds, facilities like that treat really chronic, severe patients?
So the governor's current bills that he has signed and strategies are really about what else is there than just long-term inpatient care. What we lack in our communities is actually what we title crisis stabilization work. Meaning someplace that at that moment in time, I can go for a day, a few days, to receive care, possibly medication if you need it, but also peer supporters alongside you. So individuals who have gone through this walk alongside you, clinicians to help maybe provide a crisis plan for you so that in a week or so, you can go back out into the community without having to be in an inpatient setting for a long period of time. And the governor just signed a bill for $95 million to help augment crisis infrastructure within the state of Ohio to begin to build that level of services, realizing that it's not available in every county.
Thank you.
Of course. Other questions? I think one of the other things that I will say is workforce development is something that's been on the governor's mind for years and years. He just signed a bill for $85 million for workforce development and in helping to engage folks to go into this field of work, which is extraordinary. So often mental health is sat over here, or substance use disorder and physical health is sat over here. And I see Crossroads Health being one of those leaders to say that they're not separate. They're together. We have to treat them both. We can't treat one without the other, because we know many times the medications or the illnesses that folks are, chronic medical illnesses that they're managing, affect their mental health. So if we have poor management of those things, the likelihood we're gonna have really good results with depression is gonna be really hard. We're not gonna have really great, somebody with depression, without treating their depression, the likelihood that they're going to have a lot of motivation or ability to continue to engage in wellness activities that they need to, if we're not treating their physical health, is gonna be extremely hard. They're not separate, they're intertwined together in order to do the heart, body, and mind. It's really quiet. Couple things that Crossroads Health has going on throughout the coming weeks, months. We continue as an organization to be firmly dedicated with our new directions partners in Cuyahoga County, making sure that we've got residential treatment for our youth and adolescents, outpatient treatment. We know these rates of substance use disorder continue to increase throughout Northeast Ohio. One of the things, as I was sitting on a meeting yesterday, and I'm hopeful to watch it come into fruition, which is that we need to do a really good job at prevention and wrapping folks in services early rather than later, and helping our young folks to have opportunities to make healthy choices. Right now, that can be challenging. I can tell you that Crossroads Health, as well as New Directions, are in a number of our school districts. In Lake County, we're in every school district providing prevention education, age appropriate depending upon the age of the child, for both mental health as well as substance use disorder. For our youth, COVID had an impact. I actually, for me personally, not necessarily research, but I almost feel like it was a little bit of an arrested development. Our kiddos, we took them all and said, go home, go home. And we did that for a couple of years. And then we said, okay, go back to school. And now they're 2 years older. But all those things that you learn in school, that how to socialize, how to handle conflict, how to do those things. So we've got 9th graders who maybe are struggling with 7th grade emotions, but we're trying to hold them accountable for being 9th graders. And so our school-based providers are there to help offer consultation to our teachers, provide counseling to our kiddos, to help them begin to manage through what we've put in front of them, what the pandemic put in front of them. Because mental health is something that can become lifelong for them. Other questions? Comments? I can keep talking for like hours.
I've got one.
Yes.
What did you want to be when you were a little girl?
Thanks. I wanted to be a doctor.
Ah.
And then organic chemistry came into my life. In my sophomore year of undergrad, and I went, holy guacamole, I don't understand any of this, and I might hurt somebody if I don't.
Same with me.
And so, but I knew always that I wanted to help people. One of the coolest things that I know is I genuinely believe every person on this planet deserves the best care possible. One of the things I always think about is coming here and walking into this building. One of the things I love is our operations team, our facilities team. It is clean, it is well maintained, it is a dignified environment, and oftentimes, and I've seen this time and time again with a variety of different places, we're like, well, it's good enough for those folks. And I hear those kinds of comments. They deserve more than just good enough. They deserve the best. I have a child that's on the autism spectrum that's 20 years old. He's an adult in our community. I hope to goodness that I never have a situation where people are saying, well, it's good enough for him. Because he certainly deserves the world. Everybody deserves to have the same level of access, the same level of care, and high quality care. And that's really what we are as Crossroads Health, is really striving for that excellence. And one of the things I admire about all of these lovely folks that I'm looking out, these are some of the most tenacious humans that I have ever met in my entire life. I look at data way back in the back. See, I gotta interact with somebody somewhere. These are folks these are kids that it's easy to give up on. It's easy to say, well, I don't know what else to do. This team continues to work and continues to say, we're not giving up. We're not going, it's not tolerable. Even if it's tough work, and some days it is, and some days it's easy work. But we never give up. Some of the phone calls that I hear, people saying, hey, they said they can't have this. Well, who do we call to figure out how to get them that? Because we can't not have them have this service or have this right within their school district or whatever else needs to happen. Even our teachers at New Directions, our collaboration with Orange City Schools, those teachers are phenomenal to watch them. They have no idea what they're getting when each day comes in. Like, I can't imagine being a teacher and every day, I'm like, huh, look at that. Well, that's not what I was expecting Friday. When I walked in, hi Bob, haven't met you before, but let's talk about where you're at in your learning and how I can help continue to move your education forward so that you're able to graduate from high school, that you're able to have the best chance possible. What does that look like for you? Because again, it's super easy to say, well, they might get held back this year because they were in treatment. I can tell you that our Orange City school teachers are like, I don't think so, not today. And they also bond with these kids. We provide school 12 months out of the year. We provide it so that if they are behind, that they can catch up. Because many times through their own recovery journey, school may or may not have been a priority about what's going on, whether it be with their own usage history, what's going on at home, and all those things in between. But we're gonna do everything in our power that they can have catch up, get as close as they can back with their peers, so that when they leave us, that folks leave us better than they came and have more choices and options, because really it's about choices. Many of our folks, choices may or may not have been given to them, they may have been taken away as things go on. Chronic illness is tough. It's not something that goes away, and it's something that people have to work on every single day. We hear from folks that have been in services years ago. We've got folks that, you know, I bet you if I ask all of these folks out here that have touched clients, they're gonna say, every one of them probably have a drawer somewhere of things that clients have either written or said about them, good or bad, depending on the kid, that help us move forward, right? It's about connection. And in a day and time in our life when isolation was so prevalent, the connection with somebody else can save a life. We've got crisis team members here that I've never watched a group of people create a connection like they do. They can meet somebody in their darkest hour and be their best friend when they walk out an hour later. It's phenomenal to watch. And all I can say out into the universe is that connection matters. It matters so much, and many of our folks don't have many people that they have connections with or their supports. We become their supports. We become those folks that help them, whether it be get through the next school day, get through the weekend at home, or get through the next day. How am I gonna get to this doctor's appointment? How am I gonna remember all these other things I gotta do? How am I gonna cope with this? I watch people with severe anxiety disorder go into our primary health care clinic and actually have an appointment that they've not managed to get through for years. Because just the tolerance of being able to sit there and be there and have that happen between our compassionate providers as well as our case managers who walk hand in hand with them. It's amazing. Any other questions, comments? This is weird. Hi.
As a nonprofit, talk about the challenges of hiring and retaining quality staff and what Crossroads New Directions plans to do about it.
Sure. So workforce continues to be a challenge throughout the state and for all nonprofits. So how many people have at least seen one of the, either bought a dozen eggs in the last 5 months? Right? They're like, they were what, $2, and now they're like some ridiculous, depending upon the day. In the business arena, they're able to raise prices to pass some of that on to the consumer. In the nonprofit world, we have to get far more creative because we don't get to get paid more. We advocate for those things, but what we have done is we continue to evaluate our salary ranges. That being said, every person who comes to Crossroads Health and works here, they know it's not for the big fat paychecks, right guys? Yep. I mean, or am I missing something? What we try to do is have a good environment for employees, a trauma-informed environment where we're providing regular supervision, that we're providing support. We have a really excellent benefit package, and we'll continue to be creative as we move forward through this together. But it is certainly, I will not sit here and say that it is not an ongoing challenge to retain a highly qualified workforce in this environment.
Thank you.
Of course. All right.
I'll say something.
Yeah.
So I'm Karen McClellan, Executive Director at Extended Housing. So I've got to see Shayna in her role, and it's been wonderful. And I just want to acknowledge the work of the Crossroads Health and New Directions Board and the thoughtful way they went through the transition. And from another organization, it's nice to see we all work together. And so it's nice to see that you're taking care of your organization in the future and succession, because Crossroads Health, the health of your organization, helps the health of extended housing and other organizations, and ultimately the people that we serve. So I just want to say kudos to the thoughtfulness that you put towards the succession and having this opportunity. And I wish I had some more questions. I didn't want to put you on the spot with questions either, so I appreciate everything that you're sharing, Shayna.
Of course, and it's one of the unique things about our community is, and it's not like this everywhere. I can tell you that because I've worked in a number of different counties over the years. The collaboration that happens is just outstanding. I see Dan Rowell sitting over there, who was working at Signature Health prior to coming over to the Lake Adams board. Dan and I had each other's cell phones, and he would call me and say, hey, what about this client? How do we solve this issue? How do we get this person where they need to be? And really collaboratively thinking through what can be a really complex solution. There's not a lot of turf wars. It really is about the betterment of the people we serve. So extended housing, we rely on them to provide high quality services and high quality housing options for our clients, which they do a remarkable job. And we talk about those folks that maybe are more ill at any moment in time, and how can we wrap services around them more appropriately to be able to make sure that they stay in that housing, and that they can stay in that housing, and that they continue to thrive, not just live. Living's easy, thriving is hard. And what does that look like? We don't want people to just feel like they're living and existing. We want them to thrive and enjoy their days. It might not be every day, but that they feel as if they have choices. And that's really what I see Crossroads Health and New Directions doing, is giving a choice for folks that may not have been there. More about me: I have 3 dogs. I have a lovely husband who sped over here to come help support me today. And as you can see from the cookies, my mindfulness activity is knitting. But certainly, this is just such a wonderful group of individuals, partners. Thank you all for coming out and spending a little bit of time with me, with the organization. I hope that you can, those of you who work at various different locations, that maybe this isn't your home location, or those of you who are joining via Zoom, give me a call. Come see the other locations, see what your colleagues are doing, because really it's all of us together that make a difference, not one person or me sitting in front of a camera. I'm a face of really a phenomenal group of people that really do the work. That's what I got. Have drinks, get cookies, take stuff, things.
Take t-shirts.